Welcome to Business Reporter's Best of British Business campaign. I'm Georgie Frost. What do patients expect from private healthcare practitioners? Ideally, empathy and attention, and a swift diagnosis followed by appropriate treatment. But most patients won't be aware of what goes on behind the scenes. Complex logistical and administrative tasks means dozens of hours are spent on back office work that might be better devoted to actual care. But technology could hold some of the answers in helping practitioners to focus on the one thing that really matters, the health of their patients. In this series, we'll be exploring the solutions with Healthcode, a provider of IT solutions for the private healthcare sector. In the last episode, we discussed claims management, one of the most burdensome tasks of admin. In this episode, we'll be talking to Peter Connor, Managing Director, and Richard Arris, Head of Business Development from Healthcode, who will join us to discuss appointments, bookings, and connected services. Peter, Richard, welcome. Peter, talk to me if you would about the current private healthcare booking system.
To be honest, Georgie, there isn't one. It does exist in fragments, but they're bespoke solutions, they're fragmented, they're organisational specific, and there's no joined up system across private healthcare today.
Seems extraordinary, doesn't it, Richard, that we live in a digital world and yet this is the situation with healthcare. You know, I can book a hotel or a holiday and have the flexibility of choice and go where I want to, and I can't do that with healthcare. How have we got to this situation? What are the consequences for patients and professionals that are using the system?
Well, you're absolutely right, Georgie. I think the private healthcare sector is significantly behind other sectors that have developed an online central booking system. We recognise that, and it must be incredibly frustrating for patients more than anything else that go through the experience of either having to make their own appointment, whether that be via email or telephone, or being given a choice and would you please go and select which consultant you'd like to go and see. So the lack of availability, the lack of freedom of choice for a patient is absolutely evident within the private healthcare sector. For practitioners, it's incredibly frustrating as well because they lack the ability of being able to advertise their services, as it were, online.
So talk to me about your solution.
Effectively, what we're doing is providing a big black box, if you like, where healthcare practitioners can make their services and their clinics available online. And we give them full control. They can control the distribution of who will see it, what capabilities they offer, but we're giving them the capability to make their services more accessible and more consumer friendly.
Surely with the problems that you've outlined, there must be other solutions out there doing what you're doing.
Yeah, indeed, there are some online booking solutions out there, but they tend to be quite restrictive in terms of who they're available for. So, for example, some of the big hospital groups certainly have online booking, but the problem is that if you don't work for one of those big hospital groups, then that limits your ability to advertise your services online. Equally, they're fragmented, so they don't talk to one another. They are siloed booking services. So that leads to things like double bookings, the lack of ability to be able to advertise what it is that you're available for.
This sounds like an enormous implementation.
One of the beauties of Healthcode, of course, is we've already connected the industry. We've connected the industry with the practitioners and the hospitals and the insurers. Now, yes, that is through more of a billing and authorisation transaction, but effectively we're extending that capability that we've already built. So you're right, it was a big task, but we hit the ground running and we had a great foundation to do so.
So let's talk about then the transition to using this system. Will practitioners need to learn new skills, adopt new systems?
Well, all practitioners have a diary now. It may be in a system, hopefully that's a practice management system, not an Excel spreadsheet, but they will have a diary. So effectively, all we are trying to do is to extend that diary concept in a way they can publish that diary and make that diary available online. And as I say, they will have that full control over it. So I don't think it's a new concept in any way. Quite the opposite. I hope it's going to actually release a lot of the burden and the frustration and prevent things like double booking, ease re-availability when bookings are cancelled, allow consumers to make booking outside of practice hours. So I think it's the opposite, to be honest.
What are the costs involved?
We've looked at other industries and recognised that what we want to do is basically replicate what happens there, where as a practitioner, yes, you would pay a very small transactional fee for receiving the booking, which is very comparable with the cost that you would otherwise administer.
And I think it's worth adding that if a practitioner does not have a compliance system, we can provide them with one.
Peter, where are you going with ICE in the future?
Our focus now is to get the system up and running, utilised as broadly as we possibly can, and to bring in all the major hospital groups, to bring in all the major insurers, to bring in all the practitioners. So that's our first focus and our focus now. But going forward, there's a lot more around the booking process, and there are three very obvious examples where we're heading. So number one is authorisation for treatment. The perfect time to request and receive treatment authorisation when you're insured is on the point of booking. So we'll link in the authorisation systems. Also on payment systems as well. A lot of practitioners may require a payment on booking. It's not all insured, it's self-pay as well. And again, we'll be bringing in a payment engine. And thirdly, again, when you look at the NHS system and the ERS as it's known in the NHS, they have the ability to bring in clinical information and therefore deliver the clinical record to the practitioner who is going to see that patient and let that accompany the booking. We're going to look at that and bring that in as well on the system.
And just to add to that, Peter, what we have here is an opportunity of creating an excellent patient experience within private healthcare that we simply don't have at the moment.
Peter Connor and Richard Harris from Healthcode.